I was 24 when I first moved to Canada. I was in love with the mountains, and Canada had mountains and spoke English, so it fit the bill. I didn't plan to stay, but one early morning on the shore of Lake Louise, on a hike with an outdoor club, I met Hank. 3 years later we were married in Banff, and we went on a backpacking trip for our honeymoon. For years, Hank loved to climb big mountains in the Rockies, and we had lots of adventures in the backcountry. But as our family grew, our focus changed, and those adventures became more tame. Shortly after our 25th anniversary, Hank started to have difficulty with directions, and I noticed him repeating the same questions to me multiple times in a single day. It took a while to get a diagnosis: cognitive decline, Alzheimer's type. And again, our adventures had to move to easier terrain. For the next 10 years, we continued to walk in the mountains and the local parks almost every day, but eventually I could no longer care for Hank on my own, and he moved into a dementia care facility. As his behaviors became more unmanageable, he was transferred to the hospital. One morning I got a call. The room was dark as I walked in 15 minutes later, with the uniformed guards present. And when I saw his hands and feet restrained to the bed, with him banging the straps against the side of the rails, I felt nausea. I walked right over and took his hand and began talking to him. And within a couple of minutes he relaxed. When the nurse returned, we undid his restraints while I sat with him. I learned that he had injured 3 staff members, and when I went to apologize, they reassured me that it was not Hank, it was the disease, and I didn't have to feel so dreadful. Events like these continued for several weeks, until eventually the ongoing medication changes softened his behaviors, and the old Hank shone through again. For a while. But even when Hank was doing well, the arm and leg restraints hung on his bed, and the chest restraints sat on the floor in the corner as a visual reminder of those terrible times. I had a visceral response every time I saw them. Eventually, Hank was transferred yet again, this time to a specialized program for complex dementia care. I had to retell our story to this new team of healthcare providers, but they were all trained in dementia care, and although I was tired of telling the story, for the first time it felt like they got it. Hank now has a band on his arm that allows him to move freely. We continue to walk. Now, just walking to the atrium and sitting amongst the trees is an adventure. It has been hard to let go of what we have lost, but throughout our journey we have tried to focus on the joys we can still share together, and our love of outdoor spaces has been front and center.